And as the number of infections continues to rise, so are questions about just how accurate the numbers are. CTV's Penny Daflos looks at the value of the daily pandemic statistics.
It's painstaking work done by hand, but the World Health Organization says it's the best way to prevent the spread of COVID-19.
We have a simple message for all countries: test, test, test.
And while health officials say the number of tests is growing,
doubling and doubling and doubling, and that will continue.
There are questions around the number of reported infections. With more and more people reporting despite fever and cough, healthcare workers don't test everyone.
And said, no, the testing has changed again. Unless you're sick enough to be hospitalized, they're not doing the testing.
There's also the question of accuracy of the infection numbers, which are likely outdated. I've spoken with several people who say they've waited a week or more for test results.
So it's not like we're just testing a few people. We're testing lots of people, and it has been a challenge, as we've said, for the number of different laboratories around the province to consolidate those numbers.
In Italy, where the death toll has now surpassed China and truckloads of bodies are taken for cremation, they've managed to eliminate new infections in one town. They tested every citizen in Vaud near Venice, some more than once. Their new infections are down to 0. And while that's not feasible in a province of 5 million, Henry insists they are doing more.
We've got some new equipment coming on, and the labs are working 24/7. So we're, I'm confident that this strategy will help us get a better picture of what's going on. But we certainly in no way are minimizing the amount of testing we're doing.
In the absence of blanket testing, the next best option is assume COVID-19 is more widespread than we might like to think. So continue to wash your hands, keep your distance, and self-isolate if you're not feeling well. Penny Daflos, CTV News, Vancouver.